Hello student, in this video lecture we are going to discuss about one of important topic, that is schizophrenia. Schizophrenia is a Greek word that derived from two words, schizo that means split and phrenic that means mind. That means schizophrenia means split mind. The term first time used by Eugen Bleuler. Before that, it is known as the dementia precox. Dementia precox का मतलब होता है dementia, as you know that dementia means loss of memory. Precox means जिसका onset early होता है. Okay, schizophrenia is commonest disorder. Schizophrenia is not a single disorder, it is a group mental illness characterized by disturbance in thinking, mood and motor activity. So here is some important is schizophrenia. What is the meaning of schizophrenia? And schizophrenia is the term used by the Eugen Bleuler. कब किया था? 1912 में. ठीक है. डिमेंशिया प्रिकॉक्स का अर्लियर हम क्या बोलते थे? डिमेंशिया प्रिकॉक्स इज नोन एज schizophrenia is known as dementia precox. And schizophrenia is not a single disorder, it is the group of disorder. Next we are going to discuss about the etiology. In etiology, the biological, first है biological causes, biological etiology. Genetic, there is the genetic susceptibility. If the 10% risk is there if one parent is schizophrenic. 30 to 40% risk is there if both parents are schizophrenic. In the CT scan and MRI, schizophrenic patient have the third and fourth ventricles are found enlarged. Some immunological factors that contributes in the schizophrenia: viral infection during pregnancy, increased stress due to trauma, disease or drugs. These all are the biological cause. Second one is psychological cause. Schizoid and paranoid personality that we will discuss in last video. In the personality disorder, schizoid and paranoid personality are having greater risk than other. If the patient have the low IQ, there are greater chances to be having the schizophrenia. Okay, next आता है social factors. In social factors we include the social isolation, broken families, etc. Now we are talking about the clinical manifestations. Clinical manifestation, here is a theory, 4A theory is known as, which are referred as the primary features of schizophrenia. A for the autistic thinking. First A refers to the autistic thinking, second one is affect disturbance, fourth one is associate disbalance, and last one is ambivalence. These four are the classical symptom of schizophrenia. Sometime examiner may ask you that what are the 4A of schizophrenia. Sometime he may ask that what are the classical sign of schizophrenia. So here we consider these four are the classical sign of schizophrenia. Next are the secondary features that may include thought and speech disorder, thought block, poverty of ideas, thought withdrawal, neologism. Neologism, that means formation of new words. ठीक है. Delusion of persecution, reference, grandiosity and control, emotional disturbance, altered mood, hallucination, mostly auditory, illusion, lack of judgment, lack of insight. These are the clinical features, but according to the recent concept, the clinical features are grouped into two: the positive symptoms and negative symptoms. Positive symptoms, that means additive behavior. If something is add new in your behavior, that is called positive symptoms. Negative symptoms are symptoms which are considered decline in your behavior. Positive symptoms include delusion, hallucination, bizarre behavior, excitement, neologism, echolalia, echopraxia. Negative symptoms such as suicidalness, stereotype thinking, thought block, hopelessness, social withdrawal, emotional apathy, mutism. How we can diagnose the schizophrenia? We can diagnose the schizophrenia by the history and physical examination. We can perform the mental status examination also for to diagnose the schizophrenia. Now we are discussing about the types of schizophrenia. You just seen in your notes, here we are using a trick to remember all these PHC under Punjab Rajasthan state that helps to remember, that helps to memorize these. The first is paranoid schizophrenia. Paranoid word is derived from the Greek word paranoia, that means out of the mind. What are the signs and symptoms? The signs and symptoms include in paranoid schizophrenia are delusion of persecution. Delusion, that means delusion. Delusion of reference, delusion of grandiosity, delusion of control, improper judgment, insight absent, and hypochondriasis. The delusion means false fixed belief. Okay. Next, second type है hebephrenic schizophrenia. That means most common affected to the 20 to 25 years of age. इसका ऑनसेट जो होता है वो ग्रेजुअल होता है, धीरे धीरे होता है. साइन सिम्टम्स इंक्लूड डिसऑर्गेनाइज्ड थॉट, मैन्यूरिज्म, stereotype, mirror gazing, silly behavior. Okay. Next one is catatonic schizophrenia. The catatonic is derived from two words, cata that means disturbance and tonic means muscles tone. That means disturbance in muscles tone, that is due to the schizophrenia. इसका onset जो होता है वो acute होता है and recovery is possible. Catatonic schizophrenia may show the two types of signs symptoms. The catatonic schizophrenic patient may have either he or she may have the catatonic excitement that showing the symptoms of increased anxiety, increased activity, violent tearing of clothes, echopraxia. And if or the patient may have the catatonic stupor in which the decreased activity, lack of interest, wax flexibility, and pass urine in the bed. Okay, this is the catatonic schizophrenia. Next is residual schizophrenia. Residual schizophrenia, that means patient positive symptoms, sign and symptoms are absent. Some patient may have hallucination and delusion. Negative sign and symptoms such as social withdrawal, thought block, and stereotype are present. And the fifth one is simple schizophrenia, affect mostly the 15 to 20 years of age group. Slow progression is there, difficult to diagnose. Males are more affected than the females, and flat mood is not affected. When another is undifferentiated schizophrenia. Undifferentiated schizophrenia, that means that is showing all the sign of symptoms of classical sign and symptoms of schizophrenia, but that is not considered in above mentioned categories like simple schizophrenia, catatonic schizophrenia, hebephrenic, paranoid. That person is belongs from the all of categories, that is called undifferentiated schizophrenia, that can't be differentiated with them, or that person may have some other problem such like mania, depression with the schizophrenia is known as undifferentiated schizophrenia. Is that clear? The management of schizophrenia include ECT, the best effect that is ECT, that is prescribed to patient 8 to 12 ECT, 3 per week. Okay. The antipsychotic drugs olanzapine, clonazepam, haloperidol have the best effect in the schizophrenic patient. Positive symptoms give best response to the transitional antipsychotic drug chlorpromazine, and the psychotherapies such as group therapy, behavioral therapy, and family therapy are helpful in that. Okay, if you have any doubt, you can ask me. Thank you, student. Thank you very much.